Ovulation isn't just a phase, it's the main event in the ovarian cycle where the follicle steps into the spotlight, busts free, and kicks off the possibility of life. In ultrasound, we don't just track it, we witness the drama unfold in real time. Join me in this epic discussion of ovarian cycle. But before we begin, please like, share, and subscribe to this channel for quality lectures like this. In response to hormones of the hypothalamus, pituitary gland, and ovarian axis, cyclic changes occur in the ovaries and the uterus of normal female, and these changes begin to occur from the ages of 9 to 16. These cyclic changes are known as the menstrual cycle, which represents the reproductive phase of a female life cycle. The cycle is divided into ovarian cycle and endometrial cycle. In the ovarian cycle, which we will discuss in detail, the changes that are associated with this cycle are known as the ovarian cycle. The purpose of the ovarian cycle is to provide mature ovum for fertilization, whereas the endometrial cycle, every change that occurs within the endometrium is actually the endometrial cycle. The purpose of the endometrial cycle is to provide a suitable site in which the blastocysts, the product of conception, can implant and develop properly. The typical or ideal menstrual cycle is 28 days. However, variations are common, and these variations can range from 21 and 35 days. It is customary for us to assign the first day of menstrual cycle, the first day of menstruation, as the first day of the menstrual cycle. Now, the ovarian cycle. At birth, each ovary contains approximately 200,000 small, immature primary follicles, also known as the primordial follicles. Throughout the reproductive years of a female, at the onset of each menstrual cycle, a number of these primordial follicles undergo growth and development. FSH, follicle stimulating hormone, secreted by the anterior pituitary gland, stimulates the development of the primordial follicles. The developing follicles will be filled with fluid and secrete increasing amounts of estrogen. Typically, 5 to 11 primary follicles begin to develop in each menstrual cycle, with one reaching maturity, and that one is known as the dominant follicle or the Graafian follicle. The mature or Graafian follicle makes its way to the surface of the ovary. It appears as transparent round cysts. Visualization of the cumulus oophoros at one end of the cyst indicates follicular maturity. Once matured, ovulation occurs within 36 hours. Ovulation is regulated by the hypothalamus and pituitary gland in the brain. Luteinizing hormone LH reaches its peak 10 to 12 hours before ovulation. A surge in the LH accompanied by a small FSH surge triggers ovulation typically by day 14 plus or minus 2 of an ideal menstrual cycle of 28 days. Following ovulation, the ruptured dominant follicle becomes corpus hemorrhagicum, which is then followed by corpus luteum. The corpus luteum secretes mainly progesterone as well as small amounts of estrogen, which is absolutely necessary to maintain the endometrium for successful implantation of the blastocysts and the product of conception. The corpus luteum continues to secrete progesterone as well as estrogen till the 12th week of pregnancy, known as corpus luteum of pregnancy. If fertilization does not occur, the corpus luteum undergoes regression by day 21 to day 22. Progesterone output is diminished. By the end of the cycle, the failing corpus luteum triggers endometrial slowing and menstrual bleeding ensues. The endpoint of the regression of the corpus luteum is a small fibrous area in the cortex of the ovary known as corpus albicans. An ovarian cycle is customarily divided into three phases, mainly the follicular phase, ovulatory phase, and the luteal phase. Now let's look at the follicular phase of the ovary. Now it begins at the start of menstruation, like we said earlier, day 1. It ends at ovulation for a typical 28 days, that will be day 14. The length varies, generally 14 plus or minus 2 days. So, but between day 5 and 7, a dominant follicle is determined. This dominant follicle grows 2 to 3 mm per day. But by day 10, it reaches 10 mm, and by day of ovulation, it reaches 2 centimeter to 2.5 centimeter. On ultrasound, the early follicular phase, what you visualize will be multiple small anechoic functional cysts. 5 to 11 of them will begin to develop. By the late phase of the follicular phase, a Graafian follicle reaching 10 mm by day 10 and 2 to 2.5 centimeter in size prior to ovulation will be visualized. Visualization of cumulus ovorus or ovum at one end of the follicle increases the possibility that ovulation will occur within the next 36 hours. Ovulatory phase of the ovary. Ovulation occurs at the rupture of the mature follicle. The ovum is released from the mature follicle. Normally, it occurs in day 14, which is the midpoint of an ideal 28-day cycle. Usually, some will complain of pelvic pain. Usually, we call that ovulatory pain or metal smash. On sonography, you'll see irregular shaped cyst structure in the ovulatory ovary. The ovary that ovulated, you see that kind of structure. Additionally, you see a non-dominant follicle of varying size in 80% of the cases. The minimal amount of posterior cul-de-sac fluid will be seen. These are signs or sonographic signs. Then in luteal phase of the ovary, this phase begins at post-ovulation, 14-day lifespan. Corpus luteum grows for 7 to 8 days, secreting increasing amount of progesterone as well as small amount of estrogen. If the ovum is fertilized, the corpus luteum will continue to secrete progesterone. If fertilization does not occur, the corpus luteum regresses by 21 to 22 days and the progesterone level also will decrease. It triggers endometrial slowing and menstruation will begin. On ultrasound, the corpus luteum is seen as a cystic mass in the ovulatory ovary. Cul-de-sac fluid reaches its peak volume in early luteal phase. There will be non-dominant follicle of varying sizes, which will be seen. Corpus luteum cysts. You see a small irregular anechoic structure, thick upper echoic wall margin, um, and may contain small low-level internal echoes in case of hemorrhage. Corpus luteum cysts will show peripheral hypervascularity, what you call a ring of fire that you see on the image. Size of the corpus luteum cyst will be within the range of 2 centimeter to 2.5 centimeter. Thank you for joining this class. Join me next time for a more interesting topic on ultrasound.